Well, good afternoon. National Cabinet today passed a motion of condolence for the 4 police officers who were killed in Melbourne and to pass on their sincere sympathies to their families and to their friends and their fellow serving officers. The motion also more broadly expressed the National Cabinet's sympathies and support for the broader police family, police officers serving all around the country, and of course their family members for whom this is a devastating reminder of the risks that their serving police officers or in their families take each and every day. And the National Cabinet has had to make many important decisions in recent weeks, and we're very pleased to receive the recommendation of that motion from the Victorian Premier, and all Premiers, Chief Ministers and myself stand together with the Victorian Government as they seek to support those families and those officers, in particular their fellow serving officers who continue to go through a time of terrible grief. At National Cabinet today, there are a number of quite practical issues, as always, that we were dealing with, and in today's presentation we'll be providing you on the weekly update on the nowcasting modelling, which is being done on the effective rate of transmission of the coronavirus here in Australia based on the Australian data. Importantly, at National Cabinet today, we're able to note the good progress that has been made. We're obviously familiar with the data itself, but the good progress that is being made on those core requirements that we are working hard as governments across the country to put in place that will enable our road back by enabling us to be in a position where we can have that confidence to continue to ease restrictions that are in place right across the country. Those areas in particular where it's good to receive the reports are the expansion of the testing regimes that are being employed in all states and territory. You would have heard from New South Wales earlier today and what they're achieving there, but this is occurring right around the country, Tasmania, right around the country. And this is a very important pillar of how we will be dealing with this virus going forward into the future. We already have one of the most, if not most, comprehensive testing regimes in the world, and this is a key tool for us going forward. Secondly, we're making great progress on the industrialising, automating our contact tracing capability. The app will soon be released. There are still some issues we're working through late in the piece, which is to be expected. We're not too far away now. Earlier in this week, as I indicated to you, it received the in-principle support of the National Cabinet, and we've been taking that through its final stages in recent days. That will be also an important tool for the country as we seek to manage how we live in a COVID-safe economy and community into the future. And the rapid response to individual outbreaks. We should be aware as a community right across the country that when we take further steps to ease restrictions, of course, we will continue to see outbreaks. That is to be expected. What matters is being able to move on them quickly, to identify them through both of the measures that I've just mentioned, but also, as we've seen in a very difficult outbreak in northwest Tasmania, and for the resources to come quickly, for the further restrictions in those areas to be applied promptly, and so we can get on top of those outbreaks as quickly as we possibly can. Dealing with those outbreaks will be one of the things we will have to live with when we're in a position of having further eased restrictions across the country. On a couple of quite specific issues, on the wearing of masks, and Brendan Murphy, the professor, will talk a little bit more about this, but on the wearing of masks, the medical expert panel, we accepted their advice that it is not recommended by the expert panel that they are necessary to be worn, and importantly, it's important to note that the wearing of such a mask does not protect you from infection, but if you are displaying respiratory symptoms, then it is at best a measure that prevents you transferring it to others. It's not about protecting you from infection, but that's why when people were leaving airports and things of that nature, they were wearing it to prevent the transmission. On schools, confirmation, and this is in the medical expert advice, the HPPC's document being released further today, confirmation that the 4 square metre rule and the 1.5 metre distancing between students during classroom activities is not appropriate and not required. I can't be more clear than that. The advice cannot be more clear than that. The 1.5 metre in classrooms and the 4 square metre rule is not a requirement of the expert medical advice in classrooms. We agreed also to develop national principles for sport and recreation. Those principles would address these issues at 3 levels. The first at the elite and professional level. So the major sporting codes, our Olympic sports, training arrangements that sit around support for those activities by our elite sports people. Secondly, at the community competitive sport level, that is such an important part of our way of life here in Australia, and the principles that can help guide decisions by states and territories in the future. And thirdly, at the individual passive level of sport and recreation, activities from everything from whether it's in the Shire, if you're going surfing, or if you're walking in the local national park, or whatever it might happen to be, those set of principles that states and territories can draw on in terms of getting some consistency across the country as we move into this next phase. Today, we also agreed national COVID-19 safe workplace principles, which will be released. This is all about getting Australians back to work and ensuring that when they go back to work, that they and their families can feel safe in going back to work, and to ensure there are important principles in place, there are protocols and procedures that should a COVID case present in a workplace, then the rules that people need to follow. The Minister for Industrial Relations has been working closely with the COVID Commission, union representatives and others to ensure we can get very helpful tools in place. That's what we're doing at a federal level, and that will draw on these national principles that we have agreed today as part of the National Cabinet.